importantly, you after searching for a doctor or for a clinic where hair transplant is being conducted, the first thing you should know or check for is the qualification of the surgeon. They should be either a board certified plastic surgeon or a board certified dermatologist. But just being plastic surgeon or a dermatologist, when we go to buy a shirt remains the same, but it's just you are choosing different brands as you like. In the same way, any hair transplant basically has just two steps. One is harvesting of the graft and the other is implantation of the graft. Now, how you harvest is kind of same across all the treatment options because
so it is not mandatory that you need an intravenous sedation. There are many centers who do it on purely local anesthesia. But the reason why we involve an anesthetist is because the complication happens mostly because of two main reasons: anesthesia and sterility. These are the two main reasons why person ends up in complications. From when it is sterility is breached, they end up in infection, which can be atypical mycobacteria, necrotizing fasciitis, ending up in sepsis and then subsequently multi-organ failure. Hello everyone, this is Dr. Jayanti Ravindran from Tamira Life, and I have my colleague Dr. Anish, also from Tamira Life. We both are board certified plastic surgeons, and in this video we will be discussing in detail A to Z of what you need to know if you're considering hair transplant. Hello Anish.
Hello.
Yeah, so we've been hearing a lot of news recently where a group of unqualified so-called hair transplant specialists running a center in our own city in Chennai and have done quite a number of hair transplant procedures. This was really alarming when we read the news. Right, Anish?
Yeah.
Following that, we also had subsequent calls from clients who had either booked with them or have been not aware of who should be doing hair transplant and what is the credential that is required. Because in our country, it is such that people don't test or don't check or don't ask the qualification of the specialist who's doing a procedure. Especially when it comes in to healthcare, there is a lot of trust. That's our culture. We trust what people say. But however, we see that today with the media expanding and there's so much of Instagram reels and so much of advertisements on the media, when people say that they're doing hair treatment, hair transplant, it's sort of linked to some sort of a beauty treatment.
Yes.
Is what I feel, and so there's a lot of misguidance. So today we thought we will discuss in detail about hair transplant, everything that you need to know if you are considering any procedure related to hair loss, hair regrowth, baldness, or you have patchy loss or hair transplant. I'll ask some questions to Anish and we both will discuss so that you understand in depth what all you need to know. Tell our audience what is the basic qualification. Like how do they, I'm sure all of them reach out to specialists by first starting to search on the media, right? So they either see some reels about someone talking on hair transplant, or they see some YouTube videos talking, or there is an ads, meta ads, right?
Yes.
So people search. So we all know that all these advertisement, when someone pays for an ad and it comes up, and that does not mean that is the best place. So I would like you to start off with, let us go through the journey. So a discovery, right? A patient who wants to see a specialist because the concern is either hair loss or baldness or what is it. So how do they start? What should be the correct way?
So first thing is, as you said, in the day of social media, the first thing they see is someone doing hair transplant, probably putting before and after results, and then they don't check the qualification that is necessary for them to have this procedure done. But importantly, you after searching for a doctor or for a clinic where hair transplant is being conducted, the first thing you should know or check for is the qualification of the surgeon. They should be either a board certified plastic surgeon or a board certified dermatologist. But just being plastic surgeon or a dermatologist is not enough. They should be trained in doing hair transplant procedures. That is what is important. And that is when you can make sure that your results are good and consistent.
That's absolutely right. So you spoke about the qualification, but today you see hundreds of hair clinics around the city.
Correct.
And once when I saw a patient who had a PRP treatment, and I asked him, he's also a VIP, and I asked him, who is the doctor who did PRP on you? Then he's just looking at me because he feels it's just an injection and he need not know who's executing that injection. So then that's again very, very important for you to understand that even if you're getting a PRP, that doesn't mean that anybody can do a PRP on your scalp. I'll tell you a scenario. So recently we had a specialist, he's again a specialist in the medical field, right? A general physician who had PRP somewhere, and he presented to us with multiple sort of boils on the scalp. When we saw that, we realized that it was, from the look of it, it was not like a pustule, so we knew it is like sort of a sterile abscess. So we as specialists knew that it was atypical mycobacterial infection. Now this might be alarming for you. So a simple PRP can result in atypical mycobacterial infection on your scalp, which can progress to other serious consequences. So it's also important for you to tell what are all the procedures that comes under the spectrum of hair treatment. And again, because people think that only a hair transplant they need to go to a surgeon or a trained dermatologist, but everything else it can be done by anybody else. So tell what are all the procedures and what is the prerequisite. Again, this is not about just the person who's injecting, it's about the sterility. So yes, I think you should tell the viewers what it takes to do them correctly.
I think, as you said about the PRP, I think people have the same mindset with regards to hair transplant. They think that, okay, hair transplant is a procedure, nothing can go wrong with it, it's a simple procedure. But it's only when they have the hair transplant done and they land up in trouble, do they come and visit us saying, okay, this is the issue we had. I had a patient who came from the same clinic that we were talking about, which got closed. He had no idea as to who did the surgery for him. But 10 months later, when he went to follow up with that place, they said that the place is shut. And that is when he was caught unaware, and then he approached us. So the same scenario is applicable for hair transplant or for any different hair procedures. So what all are the procedures that can be done under this is, you have different scalp injectables, include PRP, growth factors, it can include the latest treatments like exosomes or conditioned media. These are all the treatments that are commonly done in an in-clinic setting. Patients come, they get the procedure done and they go back. Similarly, the hair transplant is also done in a similar way. As you said, besides the qualification of the doctors, it's also important where the center, where the procedure is being performed.
I'll just interrupt here. So all these injectables, right? Either they are directly given as meso injections on the
Yes.
scalp, or we do a procedure called microneedling.
Yes.
So tell us in detail how these needles or the microneedles are attached to a pen, how they should be sterilized, what is the importance, how does this atypical mycobacteria happen, right? So that's important for them to understand.
Yeah.
See, what is the difference between a small clinic where you see everywhere around the city and a proper institute
Correct.
where this is done. So that's
Yeah.
important.
So in a microneedling procedure, there is a small pen which has multiple needles attached to it, and before we do the procedure, the first important thing that we do is to clean the scalp with betadine. Make sure we also give them the pre-procedure instructions to have a clean hair wash as well as scalp wash done before the procedure is done. That is important. And when they come, all these instruments are sterilized. We use what is called ETO to make sure that each of these tips are sterile, and they are single use most commonly, and we don't reuse it again and again.
And you should know that what he means by ETO is ethylene oxide sterilizers, or you have plasma sterilizers versus an autoclave. So autoclave is done when you have metal that needs to be sterilized. But some of these needles that are used, even some come in sterile packs, but all of them sometimes have plastic covers.
Correct.
And they need to be re-sterilized. Now each of these needles there is a cost. Sometimes there are centers where I have seen they re-sterilize the same needle and think they can use the same needle for the same
Yes.
patient again. That's how they cut down cost. So they put this needle into a solution called Sidex or other chemical sterilizers, but that can also grow these atypical mycobacteria, because we as surgeons, we have seen all these keyhole surgeries, laparoscopic, gone olden days, when all of these advanced sterilization techniques was not there. We also used to put them into these solutions, and we saw that over a period of time they develop these atypical bacteria. So, but that's not a practice that is acceptable today at all. So, if you want your even the simplest of hair procedures done, you have to get it done in a standard licensed clinic, not in a just like a beauty parlor. So we all know beauty parlors, you have clinics with great ambience, light, interior design, everything, but that doesn't mean they have the sterilization protocols and they have the license. So today you also tell us, we know that a clinic, they need to have what is called Clinical Establishment Act. Their license at Tamira, we are even more, we go one step ahead, and we have what is called an NABH accreditation, which means these are accreditation which the hospital takes to make sure that they follow safety standards. So NABH is not, it is something like an ISO for any products, right? So it is like minimum safety standards that needs to be followed when executing a healthcare service. So that is what this NABH means. So like this, there are various licenses. More so because the surprising part is most of the patients do not ask even when they are doing a scalp injection. Yes, of course, injections can be executed by nurses. If it is an insulin injection or you have a vitamin D injection, a nurse can give it to you. But when the injection is done on a scalp, it needs to be done by a board certified dermatologist or a plastic surgeon, because they specialize in hair treatment and they do surgeries. So it's very, very important, because today you see a lot of everywhere clinic, nobody is asking. Unfortunately, in India, we don't have a system where if you put a photograph of a doctor, you check what the qualification. And recently, because we are building an application where you actually can see the qualification. At that point, as someone also asked, how sure are we if these certificates that are also shown is actually original, or because there are people who are also have duplicate certificate. Now you need to know that there are associations in the country like Indian Association of Aesthetic Plastic Surgeon, Association of Plastic Surgeons of India, then IADVL, Dermatology Association, where if you search the name of the doctor, you can also find out if they are registered members.
Yeah, you can go to their website,
Yeah,
put the number that is mentioned on the certificate and check
so
the
it's very
credentials.
important. They should be members of these body. You have even international association called International Society of Hair Restoration Surgeons. So some of these plastic surgeons who do focus more on hair are also members of such international bodies. So you can also cross verify if they are. It's not just for hair transplant. We have enough, lot of patients coming from outside the country to India, and of course they also travel to other countries. But even they don't check the qualification, because we know that in many countries almost the entire procedure is executed by non-plastic surgeons or non-doctors, and it's done by technicians or trained, because the process of hair transplant, it's something that can be learned by seeing or by training. But what you need to know, anything that happens before or after and there is a complication, they will not know to manage. That is the key here. So you need to be very, very careful with regards to the center you choose and the specialist that you choose when you want to execute hair procedures. So because we have clinics all across the country, right? Because you see hair clinic and skin clinic, that is everywhere. I also believe that these scalp injectables are today done in beauty parlors, right?
Yes.
They do not have a specialized area where that particular section they follow Clinical Establishment Act licensing protocols and everything. So that's very, very important that you understand this and don't end up in complications that actually should not happen in these procedures. Now, having understood whom to get your procedure done from, the next important thing in hair transplant is all these names that you hear, right? All the patients come and ask us, what technique do you do, right? I just want to ask you all a question. Do you go to a heart surgeon and ask them, how do you do your bypass surgery? Do you go to a nephrologist or a urologist and ask you what the sort of a transplant procedure do you take? Then why is this question coming in hair transplant? There, you trust that the specialist whom you have chosen will deliver the best possible result. But that is not the case in hair transplant. You are hearing hundreds of marketing words. You hear all words, right? People come and ask me, do you do DHI? Do you do sapphire bleed? Do you do FUT? Do you do FUE? Anybody can keep one name, right?
I think it's a lot to do with the fact that people around us in these all clinics are marketing that we do sapphire, we do DHI. So they are ingraining in people's mind that that is the most important thing.
Tell the basic, what a patient needs to know, the basic of hair transplant. So just explain to them, forget about the brands.
Yes.
The basic steps of hair transplant. So basically, I want you to explain to them, the viewers, what is the two important steps in hair transplant and the variation in the steps that carries names.
So Dr. Jayanti would very classically put, when we go to buy a shirt remains the same, but it's just you are choosing different brands as you like. It may be Van Heusen or Alan Solly.
Correct.
In the same way, any hair transplant basically has just two steps. One is harvesting of the graft and the other is implantation of the graft. Now, how you harvest is kind of same across all the treatment options because you use the same punch. If you're doing FUE, the punch remains the same. There are different types of punches available, but you will use a basic punch to harvest the graft. But
I'll interrupt here. So I'm just going to add a little bit here. So what Dr. Anish means by punches, so the differentiating factor is you're removing a follicular unit from specific parts of your body where we understand will not be affected by the hormonal influence. So like the side and the back of your scalp or the beard or some part of the body. Now, how these follicles are harvested, that is what he refers to be as a punch, right? You punch and take, so you're not cutting anything, you're not using a blade, but you're using a punch which is helping you to remove that. Even in that, right, you have manual punches, motorized, and you have robots. So explain a little more about that.
Yeah, so most of the times we use what are motorized punches. There are different punches available in it. It takes a cylinder of tissue along with the hair and the tissue around the root of the hair together as a single follicular unit. And similarly, robotic installations are also available which can help you harvest hair from these specific areas.
Yeah, so again here I would like to come in and help you all understand in depth what this is all about. This is like, let's say now we are talking about punching and removing a follicular unit.
Yes.
This and how this punch is removal of the follicular unit is done is like, again, the equipment is like you wanting to buy a car. It could be a Maruti, it could be a Hyundai, it could be an Audi. So you have different types of medical equipments even in this punches. And believe me, so these are not against. Why does somebody buy a Maruti? Why does somebody buy an Audi? It's just not just status symbol in all that case. Of course, when it comes with certain features, safety mechanisms, etc. The same thing translating to punches here. The different equipments will come with how the quality of the graft. It also depends on the surgeon who's using the equipment. So it's not just tool alone. Just because you have the tool, it's not that you're going to get a better result. Coming to robots. So you know there are various robots that are available today. Partially automated, fully automated robots are coming for use in healthcare. Now what does these robots do is they are trying to automate the process which the surgeon is doing. That does not necessarily in all the time mean that the results are superior. It may be beneficial for the surgeon in some way because it reduces surgeon's actual time in the theatre. That was an advantage when it comes to certain procedures. Whereas in some other procedures, it actually improves the quality of life. When you talk about robotic surgery in abdomen surgery, so they are all very different because you're not trying to manipulate too many tissues. Here it is different. So let's talk about the punches. So you have different punches. And that's again where your cost for surgery differs, because let's say a clinic is deploying a specific equipment for harvesting your follicle, and obviously you have these motorized punches varying from a couple of thousands, 20-30 thousands to 7-10 lakhs, and the robots are few crores. So please see the vast difference in prices. It's similar to you buying a car, right? Maruti, Hyundai, whatever it is. You have to understand this in healthcare, right? These kind of different equipments Why it is used? Because you get grafts most of the time with better quality. The surrounding peripapillary tissue is not damaged. A very, very skilled surgeon can execute the same with even a manual punch. That's what I'm trying to tell you. But the procedure can be slowed. You might be able to do only less number of grafts in a day. Suppose you use a better machine and the surgeon is skilled, you will be able to do more number of grafts in a shorter span of time, less exhausting for you, more comfortable. Now robots are coming into the picture. There are different generations of these robots have come into the market. Initially it was only for harvesting, then it was for making slits. But then again it will depend on whether that particular surgeon is following that technique.
Correct.
Because in Tamira, we don't follow making slits. We do what is called a stick and place method, not a slit and place method. So now this is with regards to harvesting. Now I want you to also explain a little bit on what actually decides the graft survival. Very, very important, for because people think that if you hear one word, that specific brand name, that depends on your best results. So it's very important you tell them what actually decides the results.
The first thing, as you said, using the right punch, using the right speed and the right precision to take out the graft so that the peripapillary stem cells, everything along with the tissue is intact. That will ensure that as soon as the graft comes out, it doesn't dry and desiccate. Then immediately once it comes out, you need to store it in a storing medium. It has to be cold. It may be included along with PRP or other growth factors to ensure that the survival is there. Then you prepare the graft. Once the grafts are prepared, you make sure that within a certain period, preferably within 3 to 4 hours, we would want the grafts to go back again into the scalp or the implantation process to get completed. So most importantly, these are the factors. One is how the grafts have been taken, as less handling as possible while during the process of preparing the graft, then storing the graft in a good medium and in a cold temperature, using growth factors or PRP to add to the survival rate, and to make sure that within 3 to 4 hours we place it back again into the scalp.
From the time it is harvested.
Yes.
So that's why you would have heard of a terminology saying that you can harvest and implant at the same time, right? But it is not essential that you have to harvest and implant at the same time, because then if the angulation is wrong, then you will not have a geometrical placement of the graft. So you have to harvest fast. The graft can survive outside of your scalp 2 to 3 hours, and in some special medium even there are literature papers saying they can be stored for 6 hours, but at the shortest as possible. But the key here is the graft being harvested without damage to the peripapillary cells. So I tell everybody, when you go to a salon and you cut your hair, it doesn't hurt. So the external hair that you see outside does not have any life. When you pull your hair, it actually hurts because it is attached to, let's say, like a cup, a peripapillary area, which is actually connected to your neurovascular bundle. So when you pull that area gets pulled. So you might have read that when somebody who had long hair met with an accident, the whole scalp is avulsed, right? So that strong is the attachment of the hair to the roots. So if your bunch of hair is pulled, your whole scalp can actually get avulsed. So you must understand. So many people, when you wash your hair, when you comb, when your hair is falling, it clearly means that they are not attached to the root. You need to understand that. If they are attached to the root, they will not fall. So it's very, very important that you understand all of this. So the graft is the most important to determine the result is how the graft is harvested with the surrounding peripapillary cells and how less it is handled and it is put back. Now tell us, I'm sure the different techniques of how it is inserted back into the scalp. So probably you want to just give them a different technique and how they understand.
So what we do is called a stick and place method. In this we use a very small needle, like how we take for blood samples, and depending on the size of the graft, it can be a single follicle, it can be 2 follicles or 3 follicles, we will choose the needle size. And depending on where we want to insert, we can use the appropriate needle and give the right angulation and the right depth of insertion. That is the standard stick and place. The advantages are that because we are using a very small needle, you would notice that you never get a scar with a needle or a pinprick during the blood sample. In the same way, when we use a stick and place method, the grafts can be placed pretty close because the holes are very near, and also the scars that are formed subsequently will be less. So
Yeah.
that is the advantage, because we notice when people do what is a slit in place, because the slits are very big, especially in the front of the scalp, the scars can be very prominent.
When you remove the graft, if you just go and type FUE follicles in the Google, it will show you how your grafts will appear. You can have grafts which are just single, you can have grafts which are two, and they are follicular units. So single hair follicular units, double hair follicular units, triple hair follicular units, and even 4 hair follicular units. Now they all vary in size. So let's say when you're actually making a pre-made slit and then you're inserting, you're actually going to make, because after you make a slit, you can't identify that you have made smaller slits here, and then you're going to put all ones, all twos, like that. So when you make the slits, which is the length and width of the biggest graft, and then when you insert smaller grafts, the chance that likely that they can fall off, or the slit size are more, and sometimes when it's not done, of course there are skilled surgeons who do them well, but when it's not done appropriately, the slit is made and the graft is inserted at a different depth. That's when you see what is called the cobblestone. So this is commonly seen in the front, and people come and ask us to get that removed, and it's not so very easy to get that sorted out. So this is something you need to know when we are placing. So there are all the other different names that you hear are different type of equipments that are used to make these slips. Yeah. So it's whether they may use a needle, or you make a blade, or you make a specialized blade, whether it's a sapphire blade or a diamond blade or whatever it is, right? They are all just blades that are used, and why they are used is because the slits could be more precise. So obviously there is an advantage of the type of slits that are used, but it all depends on the surgeon who's doing your procedure, and it doesn't depend on one particular word. Just because someone says I am doing so and so technique, that doesn't mean that everywhere that technique is done you get a better result. So don't get carried away by this name, which is very, very important for you when it comes to hair transplant. The next important thing that you need to understand in hair transplant is the anesthesia. Now talk a little more about the anesthesia that we do, why it is the most crucial step, because this is where most of the complication happens. This is why you need a board certified medical specialist, especially a plastic surgeon or a trained dermatologist with an anesthetist doing the procedure. Yeah.
So we would what is called give intravenous anesthesia, or we can give a mild sedation. In this, during the initial process of starting the procedure, before we have to anesthetize the entire scalp, we would give what is called a nerve block. So before we give the nerve block, to make sure that the patient is comfortable, and to make sure that while doing the procedure all the sterility and every precaution is maintained, we give this anesthesia. This anesthesia may probably last for say 2 to 3 hours, and in that time we can ensure that all the blocks are given, the patient is comfortable, he is not aware of the pain, and once they get back and become awake from it, the complete area is already numb.
So it is not mandatory that you need an intravenous sedation. There are many centers who do it on purely local anesthesia. But the reason why we involve an anesthetist is because for any surgical procedure, there is a process called pre-anesthetic checkup. So we want the anesthetist to evaluate you to identify whether you may have any risk component when a local anesthesia with some adrenaline is given, because that is where the problems come. When local anesthesia is given with adrenaline, suddenly during the procedure your heart rate can go up, and then patient can have problems in the heartbeat, and this is what we want the anesthetist to check before the surgery. So this anesthetist checks before the surgery. So next time when you want to get a hair transplant done, check with your specialist whether the anesthetist is going to evaluate you before the procedure. Then you get your evaluation done. After you get the evaluation done, during the surgery, it's not 1 or 2 injections that you make, because I had once visited a country where I was seeing hair transplant, and they were just doing it at a local, and the patient had excruciating pain, and he just got up and walked away from the procedure. So in order to avoid the discomfort that you may encounter while giving multiple local anesthetics as a ring block or a nerve block, in order to keep you comfortable, less anxious, is why we give an intravenous conscious sedation, which means that this type of anesthesia, you're not completely unconscious, you are conscious. If we ask you to move, you move your head, but you don't feel the pain.
Yeah.
So, and this takes about half an hour. So when a sedation is given, sometimes people feel nauseated, so we give you instruction to come empty stomach. We finish the procedure of the block, and by the time we finish the first harvest, patient is almost completely conscious. The area where we are going to work on is completely numb, and they feel comfortable, and then they have the food and come back for implant. So this is how the procedure is done. So please understand how important is anesthesia. Most of the, I'm sure we've all have heard about death in hair transplant, and it's not that you need to be scared of, because this is a very, very safe procedure. It's that usually 99.999% you will not have complication. The complication happens mostly because of two main reasons: anesthesia and sterility. These are the two main reasons why person ends up in complications. From when it is sterility is breached, they end up in infection, which can be atypical mycobacteria, necrotizing fasciitis, ending up in sepsis, and then subsequently multi-organ failure. And in anesthesia, it is cardiac complications, patient having cardiac arrest or anything. But if both of them are addressed well, this is a very, very safe procedure. You don't have to think about it at all. The next thing is, everybody thinks in many centers there are surgeons who fly in, come and do the procedure and just go up. I am really puzzled how you would accept. Would you accept going and getting a heart surgery from somewhere and somebody else seeing you after the procedure? You won't. Then why are you doing it for hair transplant? The same surgeon who's operating on you should see you after the procedure. I mean, the fly-in surgeon, they come, they just do, they operate, and because people are accepting this, there are various technician groups that go around from places to place, and basically your surgeon only sees you in the outpatient clinic. You don't see the surgeon in the theater at all. So in Tamira, again, people ask whether the same surgeon, here we are a group of 3-4 plastic surgeons, all their certification is displayed. If you go to Tamira website, www.tamiralife.com, you will see all the credentials displayed. You can verify with the association whether the credentials, the doctors are also members of the association. That's a second verification. And all of us take turn. Why do we take turn? Because it's a long process, 8 hours, 10 hours procedure, and so there is a fatigue component, so we take turn to execute the procedure. But it's very important that you understand this whole series. Now, a little bit about post-procedure protocol. So what is the protocol we follow? We wash, antibiotic covered. Why are we doing this? See, in many countries, also their weather is different, right? So the atmosphere is less polluted, so probably they don't need a few days of antibiotic. And most important, you will see some pictures on the internet where after surgery people have swollen eyes and they're scared. Can you tell a little more about that?
Yeah, so because we are punching or using the punches or implantation process through in your entire scalp, and also we give what is called a ring block or a nerve block, there is going to be some swelling that happens in the face, and that is absolutely normal. So we give 3 to 5 days of antibiotic cover to ensure, because our climate, our atmosphere has a lot of humidity, a lot of moisture, we need to keep it dry. And then on the second and third day we give good hair wash that is supervised here and done here, so that you don't have to worry about washing your hair. We also give you what are the post procedure instructions, what spray to use, what all the solutions that we need to use for the donor area, for the recipient area, to ensure that it is sterile. And because there is a swelling that happens in the face, we also give low dose steroid for the first 3-4 days to make sure that the swelling goes away faster. We also give the instructions of sleeping with your head elevated to make sure that the swelling goes away faster. So all these are different precautions that we take and the advice that we give to make sure you have a smooth recovery.
Yeah, so you've heard all about hair transplant. So this video will be shown as a series, what you need to know from A to Z about getting a hair transplant procedure. So if you have not watched the previous video, please go back and watch the previous video. Or if you have watched all the series and you still have any doubts, you can express your concerns, doubts in the comment section below, and we will definitely reach out to you. And when you put a comment, and if you really want to hear from us, it's good if you share your contact details. You can directly DM us, and then we will get in touch with you to clarify your doubt. That it's not necessary that you need to get a procedure done by us, even if you've got procedure done elsewhere and you have a concern. And before I close, I would also like to tell you that everybody thinks if I do hair transplant for hair loss, that's the end of it. No. So let's conclude with what is important in the post-procedure medical protocol. Like, is hair transplant one-time procedure? Is it permanent? Does hair grow after hair transplant? Can they shave the scalp after hair transplant? Is it essential for them to take some medications?
Yeah. So hair transplant, depending on how much of the hair you have lost in the beginning, there are different grades of alopecia that is present depending on how much hair you have lost. If your hair loss is stable, you are taking care of your lifestyle, you follow the medicines that we give, probably your hair transplant may be just a one-time solution and you can just have the one-time treatment. But if you continue to lose your hair without having a good lifestyle, or if you don't take the prescribed medications, you may need a subsequent session. Now what is important is most of the times the transplanted hair usually is resistant to the DHT or the hormone that causes our hair fall. But our native hair or the hair that you are already having in the area where you are losing the hair, that is more sensitive to DHT. If you don't keep your DHT levels under control with the help of certain medicines, you may continue to lose your hair, and that is when this medical protocol is important. We give you certain medications along with the topical treatment. This has oral medication as well as topical treatment, and we also give you multivitamins to make sure that we protect your hair. And then depending on this, we also don't want you to take the tablets for a long period. We give in a pulse form so that we can extract the maximum benefit of those medicines and make sure that you can avoid the side effects. Now after that, if needed, we will also recommend you to take different injectable treatments like PRP or growth factors. In this way, even after transplant, it is important to have a good procedure done and follow the medical protocol to make sure that you have your good hair.
Now that you spoke about PRP, let me tell you that just because you had a transplant doesn't mean that like a timetable you have to have PRP. You have to have, definitely you have to have for 5 days antibiotic painkiller is a must. After that, to make sure that you don't have a shock loss and preserve the remaining hair, you need to follow a medical protocol. These are must. But all other injectables are advised to you as and when required. Like if you have some excessive hair loss because we give medication in a pulse, we do not advise everybody to take oral medication lifelong. So when we are giving in between the pulse, if you have hair loss, in order to prevent oral medication, because today the same medicine that can be given orally is also available as scalp injection in a cocktail formulation. So trying to in between to buy time to repeat the pulse is when these injectables. So again, don't get carried away by this marketing where they say if you do hair transplant you will get 6 PRP sessions free. So all this is like, you in every other specialty or in every other field, you know what you're paying for. Unfortunately, in healthcare, it doesn't seem so. You don't. There are all the time patients come and ask us. I don't think when you buy a car, you don't go to a dealer who sells an Audi and ask why is Maruti giving it that price and you're charging, right? But why does this question come in healthcare? Because you're not aware of what are you paying for, whether it is the infrastructure you're paying for, it is the equipment you're paying for. A trained surgeon skill is, if they're very well trained, they all should deliver the same result. But what are you paying for? You need to know that. So with this, I think you would have an in-depth understanding of where to go and whom to choose when you plan your next hair transplant or any other hair scalp procedures. Thank you so much, Anish.